Welcome and thank you for joining us today. Here at Infermedica, we'd like to share lessons from Australia, where we worked to support the rollout of one of the world's largest national AI-powered triage systems. So this implementation offers practical insights for ministries of health around the world and public sector leaders looking to strengthen national digital front doors and improve access to care at scale. So moving from vision to reality, the core issue is that getting healthcare remains a growing challenge everywhere. The challenges Australia faces are shared equally by health systems globally across Europe, the UK, and many other regions. So national health systems, ministries of health are under growing pressure from nurse advice lines, call centers, they're strained, primary care access is limited, and emergency departments are packed. People want to manage their own health, but they need guidance that they can trust 24/7. And this is where AI triage solutions come in. Only for them to work, though, they must deliver accurate and actionable advice that people can actually rely on. So let me introduce our partner, Healthdirect Australia. They operate as a national government-funded digital front door. This is a model increasingly explored by ministries of health worldwide. So their goal is simple: to help people who are unsure about their symptoms get the right care the first time through a virtual system. So they offer two main services: a symptom checker available on their website, and then a nurse advice line where you can call and speak directly to a nurse. Crucially, on both the website and the phone line, people are guided to the most appropriate and available care option for their specific situation. So we started our partnership with Healthdirect in 2022. Today, I want to share some of the key lessons and insights we've learned from this evolving work. So before we dive in, a quick quote from Dr. Nirvana Lukraj, Chief Medical Officer at Healthdirect Australia, who led this AI deployment. So they needed a new clinical decision support system that could handle and analyze multiple symptoms at once. So they wanted the tool to reflect a real medical consultation, one that considers crucial factors like predisposing factors, chronic medical history, recent travel history, etc. So the system they had at the time wasn't enough, and that's why they made the strategic decision to transition to AI-powered clinical decision support. This turned out to be a very good decision for them, as in the first year alone, the new AI-powered triage helped reduce over 300,000 avoidable hospital visits. But why was the old system not good enough? So previously, they used a rule-based decision tree. So think of that as a series of protocols and diagrams developed by doctors. While that system was reliable, it simply lacked the flexibility and power of today's AI. And that's where Infermedica stepped in. So we provided an inference engine powered by probabilistic reasoning. So this system still offers full visibility into the clinical reasoning, but it is far more powerful. So it can personalize advice by instantly factoring in risk factors and age group, and it's dynamic. It knows which questions to ask next based on the answers it receives. So the results of this shift are now published in a 2025 paper in the New England Journal of Medicine titled "Right Care, Right Place, First Time." So here are key outcomes from this transformative project. So self-assessment completion rates soared from 49% to 84%. 55% of people who initially planned to go to the ED were diverted to a less acute care setting. And there was a 46% reduction in over-triage compared to the old rule-based system. So this success was enabled by switching to a probabilistic reasoning engine. And that message is clear. The underlying technology matters greatly today. So we're moving away from those rigid protocols and towards powerful computational interference. This AI approach has been in place for the past 3 years, and the results have only continued to improve. So to give you a sense of this scale, about 26 million people in Australia have access to Healthdirect services. And just this year alone, that system is expected to handle 3.8 million interactions or health assessments through the nurse line and the symptom checker. So they continue to expand their integration through national access channels, increasing reach and ensuring consistent guidance across both digital and human supported services. I wanted to share a new peer-reviewed journal that is coming out from a study we did and plan to publish soon. It's based on 1.5 million triage encounters, and the results are truly spectacular. So when we look at the impact of AI triage on the nurse advice line, we see three key changes. So patient certainty is virtually eliminated. There's a massive drop in patient uncertainty by 99.6%. We are successfully guiding patients to the right place. So there's a 200% increase in the number of people seeking non-urgent care, showing our ability to direct them to lower acuity settings. And we are easing pressure on EDs. We saw a 33% drop in the number of users who initially attended to visit an emergency department. So looking at Healthdirect Australia and the 100 plus other partners we are honored to work with, the takeaway is clear. Major impact in digital healthcare is possible. However, we also know that achieving this success is not as easy as we might hope, and we wanted to share some of those lessons. So what are the three critical challenges any ministry or national health authority should expect when implementing AI triage at scale? So local clinical adaptation. This was critical. Our system was developed internally by over 40 doctors, but it still needed tailoring to the Australian market. So this meant adjusting triage levels, updating disease prevalence rates, and adding local conditions like snake bites that weren't in our database before. This also demanded collaboration between our clinical team and the clinical leadership at Healthdirect. Only through this joint effort did we create that system that was clinically validated and fit for their market. Change management. So this was a critical part of the transformation. Nurses were used to the old rule-based system they'd used forever. They were now facing a completely new model, a dynamic inference engine. They needed time, training, and champions to build that trust. So their clinical leadership and even the CEO dedicated that time to building the comfort, and they succeeded. The system is now well adopted and rated more favorably by nurses than the previous one. Improvement at scale. So this is one of the key reasons to implement an AI solution. The system is built to improve at scale. So we operate a large-scale feedback loop that continuously collects data and feedback from Healthdirect and its nurses. So our triage accuracy increases over time with every single piece of data that we collect. So this ability to continuously learn and improve is something no rule-based system can match today. So let's translate these lessons from Australia into implications for ministries of health and national digital access strategies. So this Australian experience demonstrates that national scale AI triage can shift care-seeking behavior across an entire population, that high completion and adherence rates reflect strong public trust in digital health guidance. They demonstrate that safe redirection away from the emergency department is achievable. And these themes align with common ministry priorities: digital first access, community-based care, and guided patient navigation. Thank you so much for your time today. If you would like to discuss how national AI triage and digital front doors can support your health systems and ministries of health access strategy, we'd love to be a part of your conversation. You can email us, our CEO, piat@infermedica.com, and you can also have a sample symptom assessment by scanning our QR code. Thank you.